you very much for the invitation and the introduction. Yes, and okay, I'm happy to be in your midst this evening, at least to talk about something that I love talking about, and to see that a lot of us young people are becoming interested in the subject of leadership, and not just becoming interested in it, but also making impact through leadership where we find ourselves. So that's great and something I'm delighted about. So straight into what we have for tonight, and I trust God to help us. We will be talking about the role of young leaders in improving healthcare delivery. All right. And somebody might want to ask why we are talking about this, because for God's sake, we are still young, right? We're still young, and we have not really started doing things. But I tell you that a lot of things are happening right now in the world, and we, in fact, a lot of young people are doing things, and the kind of change that we are seeking in the world, the kind of solutions that we are seeking in the world, a lot of these young people are the ones bringing about them, as opposed to what used to happen. If I look around, for those of us who are very active on social media, we would see many of the things happening are championed by young people. A lot of the startups, the healthcare startups, are championed by young people. A lot of the innovations that are happening are championed by young people. All right, and it's good. I mean, the only thing that we should be thinking about is what can I do in contributing to all of the great things that are happening in the world, especially in the healthcare sector, as it were. All right. So we would go through this as to guide our discussion. Yeah, so let's go over it again. We're talking about the role of healthcare, young leaders in healthcare, right? So let's go over this leadership thing again. You know, while the conversation was ongoing before I started to speak, the the beautiful lady who ushered us into today's discussion was talking about leaders, and she, in a way, was encouraging every one of us to be leaders and uh, to actively participate in tonight's meeting. Okay, so one thing I really want every one of us to understand is that we're all leaders. Okay, you don't need to be given a particular title or be called a particular thing. You don't need to be called a leader to be a leader. All right, you are a leader because of the virtue of your influence. You're a leader because of the virtue of your influence. And I tell you, if you have ever influenced anything in your life, consider yourself a leader. Even if it is as minute as telling somebody to stand, or telling somebody not to put on a particular color of clothes, or telling somebody to go in a particular direction, you have influenced the person and therefore you are a leader. So you might be wondering, is it as easy as that? Yes, it's as easy as that. We tend to overcomplicate things. So you are a leader by the virtue of your influence, and every one of us has the capacity to influence. Therefore, I would say thank you all leaders for being part of this conversation this evening. The difference between you and those people who you call leaders in quotes, the difference between you and, well, for want of examples, let me just say, the difference between you and the governor of your state is that over time, the governor of your state has built his influence. While I don't know if you are building yours or you're just leaving yours to lie fallow, because you have influence, you have that capacity on the inside of you. So the difference between yourself and the governor is that over time, the governor has built his influence. At some point, the governor was at a level just like myself and yourself. At some point, he was a student. At some point, he started working. He probably was an intern somewhere, and through all of these processes, he was building his influence. He was he had influence over people. He led them well in his own way anyway, because I can't vouch for anybody. All right, but there's no doubt that where the governor is today, where the governor of your state is today, he influenced people so much that somehow they got him into power. Either they voted for him or they collected the votes for him. Either ways, he has influenced these people. He has exercised leadership influence over them, and he's where he is today. So every one of us can also build our influence. It's one of the things I really want every one of us to take home from today's discussion, that you are influenced, you are influential, you have influence, you can lead people, you can get people to do things. It's on the inside of you. All right. And I just proved it to you. Okay. So, and these other things are what I'm going to safely assume that we already know about leadership, that leadership has to do with vision, having a vision about something, and taking people to go towards achieving that vision. So I just want to safely assume that we have an understanding of that. Okay. So what we really need to take into consideration as leaders, as young leaders, what we need to take very seriously is that you need to understand that you are not just the present, you're also the future. You know, one thing that we must seriously consider is whatever you do now will count in your future. And one of the qualities of good leaders is that good leaders, they don't think about themselves alone. They think about their community, the people that they lead. They have a vision, which usually is in the future, and they work tirelessly to ensure that that vision comes to fruition. So you are not just in the present. And I'm saying this with all seriousness because many of us may have left a number of things to chance. Classical example, you come into the university, I'm using this example, you come into the university and you are studying a course, and the only thing that we know about you is that you come to class, you go back to your hostel. If you like, you go to church or you go to mosques, and that's all that we know about you. And somewhere in your mind, you're thinking, oh, by the time I just finish studying this course now and I go into the marketplace, I'm going to start a business, a multi-million dollar business with branches scattered all over the world. But my dear, please, with all due respect, you are deceiving yourself. Hmm? Because you are still living just in the present. Meanwhile, you don't exist just for the present, you also exist for the future. And that future is not going to happen, it's not just going to happen. With every step you are taking now, with everything you are doing now, you are working towards that future. Okay. So I see a lot of persons who well, let me say there's some level of ignorance anyway. They come into the university and they don't get involved in other things. They don't build their influence because It is the activities that you do in your undergraduate level that will help you build this influence. You're not working in teams, you're not volunteering, you are not, you're not leading anything, you're not partaking in anything, and you expect that by the time you get into the marketplace, everything is going to work out excellently well. It doesn't happen like that. It really doesn't happen like that. By the time you work in teams, you learn communication, you learn a lot of things, team building, group dynamics, emotional intelligence, planning, goal setting. You learn all of these things, implementation. And by the time you go out there, it's not going to be as difficult for you anymore. All right. Then when people go into the marketplace and they try to attempt to do something, it becomes difficult. And many people just give up all the same. And they just tell you that, you know what, I just want to live a a peaceful life. I just want to be quiet. You know, the ladies will say, I just want to live a baby girl life, right? Ladies in the house, people will not support me on this one now. Mm. So, so just say, I just want to live a baby girl life. And it's not because they want to live a baby girl life. Oh. The thing is not easy. It's not easy. And what you don't learn cannot be part of you. What you don't actively learn will never be part of you. All right. So that's that. I don't want to spend so much time on this, but but it's important that I make all of these points, the salient points. Then again, our generation, my God, many of us are underrating ourselves. We are capable of a lot of things that even yourself, you don't even know. You don't know what you're capable of. And the reason is because you have not attempted anything. Have you ever, for those of us who are actively doing 18 or 2, you will notice that when you started something, you had the passion to start something, maybe an initiative or a hub, something. When you started it, the main intention was that, let's say, for example, you wanted to help your fellow students. Okay, maybe it's something academically inclined and you want to help your fellow students, or you're a business person, you started something, you want to help fellow business people. When you started it, along the line, you discovered that there was something in addition that you can do. Okay, so you now discovered that, oh, I started this network to help people academically or to help business people grow their business. Then somewhere along the line, you discovered that, oh, I can actually write a book. Then you wrote a book and the book sold 1,000 copies. Then somewhere along the line, you discover that, oh, I can even take a step further and establish a business school. That is capacity that you never knew existed on the inside of you. And if you don't start, all of these things will not come to manifestation. All right. So for our generation, I will say again, there is a lot embedded in us, first of all. And I will tell you that one of the reason we have that is, the kind of environment we are, with all of the issues and challenges and pressure, you don't have any other option than to be cooked and produce greatness. What they say about diamond, can anybody tell me what is, the precious stone called diamond? There is a condition necessary for its formation. Okay, and that's what many of us are. Okay, yes, so it is the pressure of many years that creates the diamond. All right, you are a diamond. There is a diamond inside of you that needs to manifest. All right, just take all of the pressure or all of the frustration that this country or your cause or your neighbors or your colleagues or your place of work, all of the pressure and all of the frustration that they're giving to you, pack everything, and use it to produce something. All right, we'll get there. Then, with all of the resources that are available to us as young individuals, many of which did not exist many years ago, mm, we're in the era of AI, and I wonder what some of you even use AI. Let's not talk about it because we're going to shake some tables. Okay, so we have all of these resources to use. All right, and that's why our own generation is supposed to be the most powerful generation that ever existed, but we need to prove that. Now, on the matter of healthcare, what healthcare delivery simply means is it talks about all of the possible services or actions that take place in healthcare. Okay, so from preventive care to diagnostics to treatment to health promotion activities to the technology to policies, all of these things, carrying out all of these things is what we refer to as healthcare delivery. And some of you might wonder if this is important to us or not. Of course, it is very, very important to you. You know, I say this, what I'm about to say now, I say it with some level of sadness. We I don't know what happened 20 years, 30 years, 40 years ago when other nations of the world were creating things, they were going technological, they were innovating to make their own lives better. I don't know what was happening in Africa, in Nigeria. I really don't know. Okay. Because with each passing day, when I interact with some individuals, I discover that I don't know if we're making progress or we're even going backwards in this country. And it's a sad thing. If I expect every one of us to be sad about this, right? But the question I'm posing to us tonight is that this current situation, is it going to remain the same? Is it going to remain the same? For many of us, I really would not want us to be disillusioned by the fact that, oh, we're just passing through, we're just passing through this country. There's a level of disillusionment that comes with that. Many people are in Nigeria now, believing that is a transient thing. I just want to finish school. Once I finish school within 2 years, I've japa. Hmm? That's what most people are thinking. And it's good. It's good to pursue, opportunities outside of the country. All right. And it's good to want to further. It's good to want to interact with people outside the country, know what works over there, know how they did what they did or how they're doing what they're doing, and even bring it back home. It's good. It's very important. But I also want us to realize that a lot can happen to an individual in the space of just 1 year. A lot can happen to the person. I'm talking about in terms of something negative now can happen to an individual. Using healthcare as an example, uh, an individual, let's say a young individual, would not imagine that he or she would need to be in the hospital for anything or get admitted in the hospital for anything. For God's sake, I am young, I'm kicking, I'm balling, you know, and something happens, this person is brought to the hospital, and unfortunately, the state of our healthcare, all right, and something negative happened and the person is affected. The narrative is going to change, or the narrative will not be that, oh, Nigeria happens to this person. Oh, this person was a a bright and shining light. He has a bright future. Nigeria happens to the person. And we keep saying Nigeria happened, Nigeria. Is it who makes up Nigeria, for God's sake? Somebody should help me and answer that question. They say Nigeria happened to the person. Biko, is it that there is one evil force they call Nigeria that lives in Nigeria that happened to the person? Or it is myself and yourself that make up the individuals in Nigeria? That's a very serious question that we all need to ask and answer. All right. Then again, a lot can happen in 1 year positively. You know, using myself as an example, there's a there is a project that I started in my church. We did we did a medical outreach in my church, and I saw that of a truth, one in is it 1 in 3 persons now, or 1 in 4 persons have hypertension. And we saw it live in our church. So what we now started doing, or what we did was that for every person who had an markedly elevated blood pressure, we are going to follow them up, for the next 6 months, because we want the church to be free of, okay, it's not that hypertension have a cure, but we don't want to have patients or church members whose blood pressures are elevated. Because you're coming to church every day, we greet ourselves, we see, but not knowing that somebody is walking around with a blood pressure of 190 over 100. All right. And as simple as that is, by the time we are done, or by the time we're able to achieve that, you know, it's within 1 year, a lot has happened to the lives of those individuals positively. So while we are in the country and while all of us are making plans to travel out, there is something that you can do, okay, with respect to healthcare delivery. There's something that you can do. There's an influence that you can create. There are lives that you can touch. There are transformations that you can make happen while in this transitory phase. All right. So that's why I'm bringing all of this to us this night. Okay. Now, these are the issues that we have currently in healthcare delivery. There is poor infrastructure. We all know this is something that we are conversant with, except if you are not a Nigerian. Okay. We have shortage of workforce. Every day we hear of people who are leaving the country, from doctors to nurses to lab scientists to pharmacists to in fact even non-clinical people who work in healthcare are also leaving the country. Okay. uh, a lot of issues, financial barriers, people still pay out of pocket. A good number of Nigerians still pay out of pocket. The statistics in Nigeria shows that about 3 to 5% only about 3 to 5% of Nigerians use HMO or use some form of health insurance. And in a study that I just concluded here in Benin City, although I think Benin Benin City they are trying in a way, just about approximately 12% is covered by insurance, and that's poor. That's very, very poor. So it's still a problem because people come to the hospital seeking care, but you can't attend to them simply because they can't pay for healthcare. And the issues are a lot, but all of these issues mentioned here, they all have solutions, because there are countries that do not have this kind of issues. So how are they doing what they are doing? I think we should all start with that. How do they do what they do in order to solve these problems that we are solving? And again, let me also put it to us that even as young individuals, there are certain things that we can do that will even help resolve some of these issues that we can see right now. Okay. even issues with respect to poor data and accountability. And Nigeria is a country that is very poor on data. You'll be looking for data, you won't find. You check the internet, you won't find certain data. We don't even know. In fact, at the moment we work with estimates a lot. We say it is estimated that so number of people, have this condition, or so number of people have this. And all of these things, they are important. Actually makes a great change or helps a lot in solving the problems that we experience in healthcare. Okay. So when we look at all of these problems, what comes to mind? What comes to mind when we look at all of these problems? Do we just feel, oh, is this country now? Is it not Nigeria again? Hmm? Some of us have relegated Nigeria to, can anything good come out of Nigeria? Not knowing that it is myself and yourself that makes up this Nigeria, or that makes up whatever community or wherever we find ourselves. Okay, when we look at all of these issues, what comes to mind? Is it problems upon problems that we see, or we see opportunities? I was discussing with a colleague earlier today, and I was ranting to him. Yes, I like to call it rant. I was ranting to him how that the healthcare sector has a lot of issues, which are not entirely issues, but they are opportunities. I see that the operational workflow in many of our hospitals are very poor, and it is something that I can provide solutions to. Structure something and present it to them. They buy into the idea, and of course, they pay me for the services I'm giving to them. So again, I'm going to ask, when we see all of these things, are we seeing challenges, or we are seeing opportunities? That is where we need to start thinking. We are all leaders, right? We have established that from the beginning. Are we seeing challenges, or we are seeing opportunities? And my applaud goes out to every young person out there who has seen opportunities in the face of all of these challenges. Of course, some some of us saw that, oh, there are people who are struggling with academics somehow. There are people struggling with career navigation. Okay, people come out of school and they don't know what to do, and the person saw it not as a problem but as an opportunity. And some of these individuals are preferring solutions to that. It is the same situation that is being presented to every one of us this evening. Look at all of these issues. I do not want you to see them as problems. I do not want you to see it as something that you need to escape from. You need to remove that escapist mentality from your head. I've removed it from my head many years ago. And I also want you to remove such from your head. I saw that there's a problem with leadership, especially in the healthcare sector. And many people often say that, oh, clinical people or medical people are very poor with administration, which looks obvious. Even though I try to argue against them, that we are just being passionate about the work that we do. But the results of what we see, it does not agree with what I'm saying. What is obvious is that you put a clinical person somewhere, and the next thing is that the whole system comes crashing down. That's a problem. But I did not see that as a problem. I saw that as an opportunity. And that's why we teach about these things. That's why we are learning more about these things, how to really bring out the opportunities, you know, in solving the problems of leadership in the healthcare sector. All right. And I'm encouraging every one of us tonight to also pick up this, or to be interested in this. Now, what is your role? Okay. In all of these things that that we have said so far, I want us to begin to think. So, in all of these things that Dr. Oreoluwa has been saying, what is my role really? What am I supposed to do? What can I do? Hmm. What actions do I need to start taking? Okay. And I let me just make this point clear that you do not need to do anything bad for bad things to happen. The way the world is, if once you just relax, you see bad things happening just by relaxing, just by folding your hands and watching things. Bad things will just naturally happen on its own. So it becomes important that for good things to happen, somebody has to deliberately do good things. That's just the way the world is. It's a fallen world, it's a broken world. All right. Good things do not, good things do not usually just happen like that. Somebody needs to do something for good things to happen. But if you want bad things to happen, you don't even need to do bad. Just relax. You see bad things naturally happening. Okay. And because many of us good people, I know you're a good person, right? I know you that I'm talking to, you're a good person. Yes, at least everybody says they're good people. So, out of your good heart, what good are you doing in order to avoid all of or to prevent all of the bad things that will naturally occur? So, this is a call to action for every one of us, that we should not just leave things the way they are. We should not just leave things the way they are. Okay, there is something that you can do without even expending so much of your energy or your resources. I know that's usually where the problem is. You know, somebody you tell somebody to do something and the person goes, I beg, I don't have time for this. I'm busy. I'm this. I'm tired. Some people are just naturally tired. Anything, I'm tired. I don't have power. Are you a powerless person? Have you? I don't know if you have come across some of those individuals. You approach them, can we? They have not done anything, but the next thing they're telling you is that I'm tired. I don't have energy. I don't have power. And the funny thing, as they continue to say it, it becomes a reality because you're you you are the first leader that your body responds to. You are the first leader that your destiny responds to. So if you continue to say, "Oh, I don't have power for this thing. I'm tired. I don't have energy," that is what you will eventually display. Yes, that's what you eventually display. As one of the things that I've learned for myself, that I continue to tell myself that, oh, I'm one of the best leaders that this generation is pleased to have me. Yes, and you need to tell yourself that. You need to tell yourself that you're a problem solver, that there is no challenge that is too difficult for us to solve. Okay. And by the time you start to say that, your body responds to you are a leader. Okay. And the first person that you lead is actually yourself. In fact, if you don't lead yourself, there's no way you would respond to anything else. You have to lead yourself to even give other people the permission to lead you. So if you're not leading yourself well, you're not going to make any kind of progress. All right. So please, we're not living things the way they are. Okay. Refuse to be a spectator. All right. Refuse to be a spectator, because the reason we have all of these challenges is because everybody's just watching. Everybody's just sitting and watching. Imagine that every one of us is up and doing. This world is going to be a better place. Definitely, this world is going to be a better place. I've worked in teams before, and I've really enjoyed working with some teams because everybody on that team, everybody on the group, they were up and doing. They they spotted problems, even addressed them before even escalating the problem to me, their team leader. All right. So yes. Do not just when you see a problem, that's where it all begins. When you see a problem, ask yourself what you can do about the problem, no matter how small. If there's something you can do about any situation, no matter how small, do it. That's where it all begins. That might just ignite the fire that you need to make transformation in this world. All right. Do not ever undermine the problems or the circumstances that you face, no matter how tiny they are. In my place of work, one of the things that has made me stand out is that you I see a problem and I'm troubling everybody. In my place of work, they call me troublemaker. Say I'm always looking for trouble, and I love it. Okay, well, in my own mind, I'm not looking for trouble. If you put that say I'm looking for trouble, what I'm doing, I just want things to work out well. Yes, you know, I come to work and a patient that's supposed to be attended to is not being attended to, and I'm asking why is this patient not attended to, and they ask is the patient your patient? The patient is not your patient. Why are you troubling her? Like, I will trouble you. Yes, you know why I'm doing that. I might not even be doing that because I'm well, to an extent, that to a small extent I'm interested in patients, but what I'm doing, I'm trying to instill in myself a solutionist mentality. I'm trying to instill in myself the mentality of a problem solver. For God's sake, you're going to be in an organization tomorrow, and you think that all of a sudden, when issues come, you will just solve it. It doesn't work like that. So when we begin to man the big organizations or by getting big projects to solve big problems, if you are not currently solving the small problems that are presented to you today, how would you solve the big problems that will be presented to you tomorrow? In fact, the big problems will not even come, and you just remain at the level where you are. And you'll be wondering, other people are doing things. You will now be asking yourself, where was I? If I let me say it, where were me? You know, say, where were when other people, when all of these things were happening? You know, that's just the way it works. Whenever I'm on duty, I see that a lot of patients come. In fact, some of my colleagues, they don't like to work with me when I'm on duty because they believe that my hands attract patients. And I said, that's you people's business. I don't know if that thing is really a thing though. That when somebody is on night shift, that is when patients will be coming the most. But I see it as a good thing anyway. And this is what I believe. I believe that it's because God trusts you to take care of those patients, and that's why they are coming your way. That now I don't know how it works, but they all come and they all get attended to. All right. So those people who will come to night shifts and be praying that patients should not come, or they praying that nobody should disturb them. They just want to sleep through. And I go and I ask them again, troublemaker has come. I ask them, did you come to work, or you came to work to sleep? And they be like, okay, person or sleep again. But if you don't build yourself to be attending to issues, how do you how do you build the stamina to take on projects? Anyway, before I start to digress into serious matters, please don't leave things the way they are, no matter how tiny an issue is or a problem with. Attempt to get it out of the way. All right. Then, yeah, normalize picking up. I just mentioned some examples to support that. Okay. And again, yes, like we mentioned earlier, you don't need a position to do things. You need a decision. You don't need a position. You just have to decide that this is an issue and I think I can do something about it. There was a time in my hospital we need to transfuse a patient, and every time blood bank is telling us there's no blood, there's no blood, there's no blood. I got tired of there's no blood, and we did a blood drive. and in that blood drive we collected 42 units of blood, and somehow we try to implement a sustainability, structure, so that we can continue to have blood in the hospital. And we should stop this mentality of, oh well, it does not really concern me. It might just be somebody who is close to you that comes to the hospital, and or okay, because I'm in healthcare, that's why I'm using the hospital example. It could just be anything. Okay, it could just be anything. There is a there is a startup that makes, medication, even the scarcest of medication, available to individuals. Okay, so the person saw it as a problem. The medication is prescribed. The medication is nowhere to be found in this environment, but the startup function in such a way that no matter where the medication is, they can get it to that individual. It might just be somebody close to you who needs to get that medication, who needs to get any kind of service or whatever. But because of the solution that you have provided, or something that you're working on, you'll be able to help the person. Okay. So these these are what we need to start doing going forward. All right. Your current position is enough for you to start. So whatever it is that you are, be you a student, an intern, a healthcare worker, a non-healthcare worker, a whoever you are, where you are right now is just enough for you to start. Like we said, you don't need a position, you need a decision. Okay. So use that. You can lead yourself. You can influence the next man close to you. You don't need to start your influence by influencing 100 people. You can start your influence by influencing just one person. You can drag this one, but call upon this one person and say, this is an idea that I have. Can we work on it together? Can we do something about it? And that's where you start. That's where you begin to solve the problem of that we experience in healthcare delivery. All right. Then we can't keep saying, oh, there are not enough resources. We Nigerians, we have been built to be resilient people, especially we young people. I was teaching in my hub. That was which month now? That should be in April. Yes, I was teaching in my hub. And one of the things that, look up, we hear me.
Yes, sir, we
Yes,
can.
sir.
Okay, great. So I was teaching, and for those of us who have worked or those of us who have been around the hospital environment, there is this thing they use in tying your hand whenever they want to give you an injection in your vein, or they're looking for vein. Okay, this is the time. Please, that thing is not the real thing though. We call it tourniquet. That's not the real. In fact, you can go online and check what tourniquet is. You will see what tourniquet really is. You know, but somehow in Nigeria we just improvise. Maybe an infusion set that is no longer in use, we cut it or arrange it. We now, this is tourniquet. Tourniquet have come. I was like, okay, oh wow. And it's the same way in the lack of resources. There's something that you can do, because if you just believe that, oh, there's no resources, everything have, then you just relax. Then how are you a problem solver? How are you a leader? How are you addressing the issues that surrounds you? All right. So we can't keep saying there are no resources. Yes, we know that there are no resources, but it's not the end of life. It doesn't mean that we can't attempt to solve the issues that's affecting us, that's affecting healthcare delivery. Okay. There's something that you can do. And listen to me, maybe somebody here is asking, so what will I now do? Okay. In leadership, I tell people that you you're not doing the reason you don't do well in leadership is not because you don't have the ability to do well. Okay. It's because you are missing some of the right steps that you need to take. Everybody is at different levels of their leadership. For some of us, we know how to assemble teams together. We know how to draw, structure a plan. Okay, good for you. For some of us, we don't even know how to talk to somebody about something. You come into an organization, you say, "Oh, wait, this is the vision of your organization. We need you to talk to other people about this and bring them in." You don't even know how to do it. And one thing I tell people is that no matter what level you are in leadership, if you want to make progress, climb on the shoulders of those who have gone ahead of you. You can never miss it. You can never miss it. Okay, so if there is a challenge, there's a challenge in healthcare delivery, and you're attempting to address, there are people who have been attempting challenges. All you need to do is talk to them, and by the time you converse with them, you get insight on how to go about what you need to go about. All right, then use your smartphone as a tool. Now, on the issue of smartphone, for those of us who are close to me, will know that I always talk about these things. And I was talking to a group of people some months ago, and I was, maybe the kind of things I said scared them, and I'm going to say it here too. Should like be scared. So I told them that time is life, and that when you're wasting time, you're not wasting time, but you're wasting life. Did that scare anybody? Okay, we're strong people. Nobody's scared. So time is not just time. Time is life. All right, and whenever you say you are spending time, you're not actually spending time, you are spending life, because we all are not going to live forever. So there is time. There's time for it. There's a time to be born, and there's a time to die. So nobody knows if we are going to live, if you are going to live 100 years or 200 years. You don't have that information, but somehow you know that you're going to live for a number of years, which is time, and eventually the individual dies. Now, all of those years are filled with days and hours and months. Now, if we take out of that time and we spend it on frivolous activities, you are not wasting time, but you're wasting life. Now, look at your life and begin to see how that you can take out of your life, not out of your time now, out of your life, and use to do meaningful projects. Use to do something that will count, both for you, your society, your family members, your village people, and even the Almighty God will be proud of you. Exactly. All right. But we give our time, sorry, we give our life to watching the lives of other people. And it's bad though. It's very bad because we're helping them to fulfill their own priorities while leaving our own priorities. Okay. The person who comes to social media to dance and we watch them, that is what they want to do. That is their own priority. Their own priority today is that they're going to come on social media and they're going to dance and they're going to have 1,000 likes. They're going to get 200 views. That's their priority for that day. And you're helping them to fulfill it and you're leaving your own priority. And you have told yourself that, oh, I'm going to organize an outreach. You have been telling yourself you're going to organize an outreach for the past 2 years, but you have not even even the plan you have not drawn. All right. So use your smartphone as a tool. Let your smartphone help your life, not waste your life. That's why when it got to smart, like my tune changed. All right. So these are very important things that we need to start paying attention to going forward as leaders, as change agents, as agents of transformation. Okay. So very importantly, as I begin to round up, look at look around you. Okay, let's not go too far. Look around you. You know, as some of us would say that, I'm going to develop the cure for HIV, maybe for example. Or some of you would say that I don't like the way they are behaving in this hospital. I'm going to build one standard hospital that, we beat other hospitals and providing standard care, you know. But at the moment, what are you doing? I said this before, that you can't just wake up 10 years from now and expect that everything is all going to be fine if there is nothing you are actively doing right now to ensure that in 10 years time, is in 15 years time, everything is going to be fine. In fact, right now, there are certain things that you will do that will save your own life, that will save the life of those around you, your community members, and even your village people. Sometimes even your village people, they need to be alive to see your wondrous works and glorify your Father in heaven. All right. So look around you, ask yourself these questions. Okay. What what maybe it's something you have not been paying attention to, because the issues, the problems, they are all around. Okay. The Bible will say, "Opo," right? So look around you. Maybe something you have not been paying attention to. It's let's say for this night now, it is the first step that you need to take as we are training ourselves to become change agents, to become agents of transformation, to become young leaders, you know, leading leading uh, change in healthcare delivery, positive change in healthcare delivery, solving problem in healthcare delivery. This is where we need to start from. For things that we have not been paying attention to, look around you. Okay. Then the your eyes will begin to open to see areas that you can possibly do something about. All right. There are a lot of people out there who are still very uneducated about the issues of healthcare. It's something. For example, people still come to the hospital and they say, if I used to tell patients that, can you people just allow malaria and typhoid to breathe? There's no sickness that is not malaria. I don't know if that's what happens in your own set in your own area. Where I am, everything is malaria and typhoid. Person comes to the hospital coughing is malaria and typhoid. Person comes to the hospital with leg swellings, malaria and typhoid. Person comes to the hospital. This person is obviously an adult, and the maybe person is season is malaria and typhoid. Everything here is malaria and typhoid. Then when you walk along the streets, you see some speakers, all those olden days horn speaker. They will be singing song, playing music. They say that this drug cures hypertension, it cures diabetes, it cures gonorrhea, it cures syphilis. Only one drug. That is misinformation. And I tell myself that one day I'm going to go to that pool and pull down that speaker. I've not just had the time for them. No, I will do it. And when I've done it, I'll come up with online so that you all will see it. That's a problem. People need to be properly educated about healthcare. All right. And I tell you that if people are better educated, it goes to solve a lot of the problems we have right now in healthcare. All right. So look around you. Look around you. They're all there. Okay. So ask what process is wasting time. These are just examples. What process is wasting time in my department? Which you know, which of my colleagues are quietly suffering burnout. These are issues that you can attend to. I have a teaching on burnout because I saw that many leaders, many of especially amongst young individuals, student leaders, young leaders, because of the amount of work that they need to do, burnout sets in. So I did a teaching on burnout. I was really helpful to people who participated in it. All right. So the issues are all around. And very importantly, this is one of the things that's really helping us right now. You can't we really can't make impact alone. Okay. You need to collaborate. So don't compete. We need to collaborate. Look for people who have seeming similar ideas with you. All right. Collaborate with them. let's do something bigger. Let's do something greater to impact our environment. A win for your environment is also a win for you. You know that. All right. So ask yourself, what ideas can you start? I'm not the one that will give you ideas. We have the way God created us. He gave us certain inclinations and passions for different things. Okay. I am very much inclined towards leadership in healthcare, towards management in healthcare. Things can be done better. People can be influenced better, can take better decisions. Our operations can be better. That's my own inclination. Your inclination can be something else. It can be towards children. There are a lot of children on the streets, and that's what your passion is. That's what's your inclination. And there are challenges that are associated with this age group. That's what I want to do. So it's not okay. You're just there. You keep thinking about the idea. You never take one single action. And I mentioned earlier that you don't need 100 people. You can start with one. All right. So what ideas can you start working on now? I not say tomorrow, I say now, because I expect that after tonight's meeting, for all of you who may have had one idea, one thing you can do this night is to get a book and write it out. For those of you who have written before, one thing you can do tonight is to go back to where you have written it and break it down into smaller achievable goals. Okay, that's not what we're talking about, but I'm just mentioning how you can begin to go about this, these ideas. So over here are some of the things that I mentioned just to help. Okay, we can do a patient education campaign. It goes a long way to help in healthcare delivery. We can do surveys, collect data to show that, oh, this is actually a problem. I've been talking about the problems and people don't want to hear. But now I've gathered data and I've analyzed it and I've presented it. People should do something about this. We can mentor people. Okay. A lot of people are going astray. We can mentor them, and it will go a long way in helping the person who the person who becomes a leader in a health organization tomorrow. If the person was properly mentored, will probably not be having the problems we're having right now. Yes. All right. So different ideas, outreaches, advocacy, and even in the use of technology, artificial intelligence, there are a lot that can be done. You know these things. I know you know these things. All right. So we can start working on them. Then lastly, is it lastly? Okay. Never stop learning, or you start dying. Okay. The knowledge of the past, many of the knowledge of the past, they are not helping us today. And unfortunately, even in our colleges, they still teach some very old things. Maybe that's part of the reasons we are not making progress as much as other developed countries. Okay, so learn the current best practices for everything that you are doing. Okay, so, and I believe that by the time we go back to work on all of these things, we'll really be innovators, change makers, and agents of transformation wherever we find ourselves. So the healthcare system needs us now, not tomorrow. It's now. All right. So you're hereby encouraged to go and make the difference now. Thank you very much for having me.